That's a great question, Sanjana. And I would say that the biggest challenge that they face is in terms of that physician remembering you, because there's so many medications out there, there's so many companies out there, they're going
Mm.
to have a hard time remembering, who you are and which product you're currently representing.
Yeah.
So I think building that relationship, that's sort of, and especially that face-to-face relationship. Prior to COVID, that was sort of one of the main ways that pharma reps would approach physicians, calling that office and making an appointment and then showing up and having that 15-minute conversation with that physician. And it's something that you can't just do once. It's something that, every 3 to 6 months minimum.
Yeah.
You have to be kind of revisiting and going through. There could have been changes to the way the product is described. There could have been a change to the packaging or the dosages. And ultimately, it is also the marketing material. So what do you actually hand to that physician, and making sure that typically there's actually two different types of materials. So the first is the physician-facing material. So that might have something called the product monograph that has more detailed information of how that medication works. And, let's say the dosage requirements and what they need to look out for in terms of signs and symptoms, in terms of side effects to look out for the patient. And then the other half is the patient-facing material. So this is typically material that's written in a bit more of a visual manner, so they can see what the medication looks like, how you take the medication. So for example, when it says take it in the morning, they'll put sometimes a sun, right, to represent like taking something in the morning. If it's supposed to be taken with food, they'll put like a little picture with food. So really help to enforce that consistency of that medication. So I think those are some of the biggest challenges and I think even the information overload that I find is also a challenge, because the products are constantly changing.
Yeah.
And there's new products coming onto the market. The reps themselves are having trouble understanding, okay, well, what is the new thing with this particular product? And then remembering it and then being able to relay that to the physician. So those are a couple of challenges that I've noticed.